Hello, my name is Catherine Rutland. I'm Clinical Director for Denplan, part of Simply Health. I hope you're all doing okay. We're a little bit longer into this time period and just wanted to send you my thoughts and feelings. It's so hard for all of us in so many different ways. That's what I see. What's affecting people is very different in all senses. So that's my first thought. That has to be paramount at the moment. However, of course, there are lots of other things going on. And I know there are still a lot of frustrations around hubs not being open and so on. So I just wanted to share a bit of information of what we have picked up across the country and what is going on. The first thing I'd like to say, though, is please, can I ask that you make sure you stay in contact with your patients. We are expected to stay open at this time, not open physically. I get that, absolutely. But certainly from a virtual perspective of being there within working hours to support our patients as we would normally. So whether that's by phone, by email, I know some people are doing it through Skype calls or FaceTime, all sorts of different things, some really inventive ways of making sure you keep in touch. Please do so. Certainly from the perspective of your Denplan patients, it is expected, it is part of the membership agreement that you do cover and do not abandon your patients. There is also a bigger picture here as well. If you're expecting your patients to continue to pay their capitation payments, if you want them to be there at the end of the time period, however long it is that we go through this, we need to engage with them at this point in time. So that's my big plea. We are getting a huge increase in calls into our centres of patients who are frustrated because they can't even speak to anybody at their practice. So please make sure that you're doing that. We've had questions regarding if I'm redeployed and I can't be there in the practice, fine, but do it like you would do if you were on holiday and there was nobody there to cover. Speak to your local practices, those that you're on a rota with or you get on really well with, that will cover your patients during the day to triage them in the time frame that you're not there. As I say, it's about caring for your patients now, but it's also about thinking about your business for the long term. So I can't reiterate that enough. Please. The other thing that we have done and are just to look out for because it's in different form is that Insight magazine will come out to you by email this time. Please do share with your team. We know from feedback that lots of team members really enjoy reading all the little bits and bobs in it, and especially at this time, especially if they're furloughed and they're not particularly around, they don't have to read it, but it might be worth asking them if they would like you to share it with them. So it's a way of keeping in touch with them and keeping them thinking about their CPD and their professional development. On the professional development note, there we are looking at how we can provide training to practice teams in this time when they aren't possible to come in and do them. So certainly our academy training team are looking at how they can do that from a Teams meeting perspective. So you've got that live engagement and that you can therefore gain some CPD and do something really productive in the time frame. And we're looking at other avenues with that, and more around that will come out over the next coming days when we've got a little bit more clarity. But do look out for that. The other thing that I mentioned last week that we are now, as of today, starting is that I'm very lucky that I work with a team of fabulous practice advisors who are based around the country, and many of them have mentor and coach training and are experienced in helping practitioners in need. We would therefore like to ask that any of you who are really particularly feeling that you could do with somebody slightly outside of your circle, or you may not have somebody that you feel you can talk to professionally, then please speak to your consultant and they will sort out through my team for somebody to be able to give you a call. We're really conscious in this difficult time that people are struggling with different things, and it might not be your practice, it might be underlying things you've been worried about that this then triggers. So please, we are there for you, but please go through your consultants. The practice advisors that are supporting with this, as you can imagine, it is not their role to be talking about any of the financial side of the Denplan agreement, not necessarily the financial side of business, but the things that you're asking us for financially, and also from the kind of general service level things. Those are things, again, that should be dealt with by your consultant. But if you feel that just speaking to a peer and being able to air your concerns and worries and stresses at this time to somebody who most likely will, if not currently owns a practice and really understands exactly the stresses and strains you're going through. So if you would like further information on that, please do speak to your consultant. We are constantly working on what we can do. We are constantly taking your questions and feedbacks and looking at how we can help and what we can do further. It is still, as we say at the moment, it is still a struggle in the sense of people getting access to hubs. We're very aware now that they are being set up all over the country, but the struggle at the moment is people actually getting hold of the correct PPE, and this is causing big frustration. Please look out for things like the faculty website, BDA members, if you're BDA members, on guidance around who you shouldn't see, remote prescribing, risk assessments, if you felt you had to see a patient face to face. In some jurisdictions that is more clear than others. I'm not commenting on that either way. I'm just saying please do look out for the guidance if you're getting to that point, considering that. But even for triaging, it's important that you make sure that that triage advice that you give is correct. If you feel you need to prescribe, that you're still going within guidelines. So it's really important to make sure that you've read that information and keep that sorted and in your head. So I won't go on too much longer. I just wanted to reiterate that we are there for you, and it is challenging times, and the sort of information that we're starting to get now is that this potentially could go on longer than we initially thought, and we need to find ways of helping you to protect your business, but also making sure, if we can, that we can help you to, as I said earlier, keep up your clinical CPD, that kind of thing, so that when we come through this, that's one less thing to worry about. So I wish you well, take care, keep safe, and I'll speak to you soon. Bye.